Hello, good morning, good afternoon, good evening, everyone. First of all, thank you for attending our conference and our speech. My name is Deborah Moreno. I'm from Barcelona, Spain, from ICO, Catalan Institute of Oncology, and I'm here on behalf of my team of e-Oncología, and we want to share with you our experience in the last 20 years beyond our e-learning platform about oncology. Thank you so much. First of all, as all we know, the incidence and the mortality associated with cancer is increasing the last decades. And for this reason, it's important to implement actions against cancer. And one of these is to implement these actions in the training section. And of course, in our case, following the guidelines of the European Commission. Catalan Institute of Oncology is a monographic cancer center based in Barcelona. We've got 4 main branches, one in Barcelona, 2, another in Badalona, Girona, and Tarragona. And there is a network of hospitals, of regional hospitals, that belongs to our institution as well. We attend more or less the 45% of cancer population in Catalonia, and we have been born in 1995. Our platform, e-Oncología, has been arise in 2004 with the hand of ICO and UOC, that it's the Open University of Catalonia. And the main aim of developing this project was to give response to all the training needs of the oncohematology specialists, not only doctors, as well nurses, biologists, epidemiologists, health public, and other staff that are helping and treating patients in their cancer journey. The training platform as well have another aim that is to be the first platform in Spanish language that develops specific training materials in the oncohematology field. During these 20 years, different strategies have been developed in order to give continuity to the project. And we are going to see one of it in this presentation. First of all, our pedagogical model is focused and centered in the student, with adapting the contents to their needs, profile, and interest. It's important also to say that we've got different levels of training in the basic way and also in the master's degree, and in different formats also, synchronic, asynchronic, more short, more larger, etc. We count with national and international experts that give the endorsement and their expertise in reviewing and updating our materials. And also we offer personalized tutoring in active or in reactive or proactive way. It depends on the course. First of all, when we receive a project, we contact with the experts to prepare, write, and adapt the materials or update the materials. The content is also reviewed by the main scientific societies or institutions. We also have the feedback from participants in order to improve these contents to the next launches. And also, we are also aware about the continuous scientific inputs and reference that are arising in these times, going to the developing of new treatments and strategies. Another important point to share with you is that the Oncologia always have provided support to low middle income countries with our trainings. The model that we use to do that is the train the trainers models and a pyramidal model that we, first of all, made the training with an experts, and afterwards we give independence, but also support to the countries and to the sections in order to develop the training in their territories. It's important to say also that we not only adapt the formats for the technological issue to adapt and become more comfortable and have more usability by the user, and also we provide support to the experts in order to in a theoretical area. This is our team. We are composed by different profiles. I am a physician. I am an hematologist, palliative care specialist, and a PhD, and I'm professor in the university. And the last 3 years, I'm become leading of the lead of this gorgeous team. My partners and my colleagues are expert project managers, also experts in pedagogy and in graphic design. Sorry, I want to thank to the beginners of this project, that are Xavier Bosch, Dr. Ramon Colomé, Ana Sedano, and Dr. Asunta Compañ, that they were the initial team that made this success possible. So thank you so much. We've got Oncologia not only have training programs, also we've got a research project. First of all, we want to introduce our training program, that it's based in 5 main branches. One of them is the Master of Clinical Oncology that we perform jointly the Spanish Society of Medical Oncology. All the residents of our territory made this master in order to homogenize their knowledge. Afterwards, we've got the continuing medical training program, the oncological nursing training program, and a specific postgraduate program about epidemiology and oncology research. And also we've got a very hard and large program in HPV prevention. This is one example of our courses. We've got different formats that are very usable. We've got online and PDF content, also case studies, self-assessment, discussion forums and debates with professionals, and also technical support. During this journey, it had been very difficult if we didn't count with our main partners. We've got a very important partners, not only in a national level, but in international or European level, as are the main scientific societies in the field of oncohematology, and also the main universities of our territory. It's important to say that we've got a partnership with international agencies as the World Health Organization, National Cancer Institute, or the American Cancer Society. Our training are always accredited by the national level of Spain, and we count with different endorsements of different scientific societies. It depends on the thematic of the course. This guarantees the quality of our contents and supports the excellence of our training programs. As we commented before, we not only count with the training programs, we also have research in cancer education. Now we are involved in 8 European projects that are focused in HPV or digital skills, or telemedicine focused in the cancer field. The last project that we are involved is the Interact Europe Use 100, that it's aimed also to perform a specific training in the interdisciplinary team. Finally, our sustainability and financial model have become important in order to make the adequate remuneration for authors and tutors. and also made this an accessibility, and especially in the regions that we commented before, that in the low middle income countries. Our project is a self-sustainability. Our main funding resources are the competitive grants, the institutional agreements, and educational grants from private companies. And this made that our students, the 80% of our students have a grant to perform our training courses. The results are to arise the maximum self-sustainability and accessibility in economical terms, and also to establish a loyalty with the authors and tutors. Finally, our results are that in these last 20 years, we've got more than 2,300 hours of online materials in oncohematology, divided in 110 courses. One of them are in 8 languages. Our main aim is in Spanish language, but due to our spread around the world in low middle income countries, the specific courses mainly in HPV are in 8 languages. We count with 277 professionals and experts of national and international level, and our students are around the world, and there are more than 83,000 students. And sorry, before I say 80%, we've got 70% of certificate participants. Finally, and for conclude the session, we've got some challenge and our vision of future. It's important to say that the learning training is important to adapt to the changes and the evolution of the new technologies. Due to the pandemic, it's important that there are a lot of initiatives that are online. So we have to adapt and to give response to the needs of the students in the more usability and operative way. It's important also to arise that the challenge of return to face-to-face trainings after the pandemics. And also we have to take in account that each time the clinicians are more have more work load burden, and it's important to have this in account in order to promote the development of new courses. Finally, our future, we want to have an international or European certification of our platform. We want to update our pedagogical model, also and always adapt and update our contents to the new develop of strategies and treatment, and maintain the strategic collaborations and participations with our main partners to achieve the key milestones in the development of the platform. So thank you so much for attending this conference, and see you online. And if you got some questions, we respond after this. Thank you so much.